We're going to be giving an intramuscular ztrack injection with a reconstituted medication. We are going to make sure we have the right patient, the right drug, the right route, the right time, the right dose, and the right documentation. So, first we're going to perform hand hygiene. We are going to look and see what we got here. We're going to check our physician order. Ashlyn, no. We're going to check our physician order, and it calls for 1 gram of Rocephin. So to mix that, we are going to do 500 milligrams per milliliter, which would be adding 5.6 milliliters. So we are going to do 2.8 twice. So I washed my hands. Now we are going to take my needle. We are going to change needles. These are all 22 gauge, 1.5 inch needles. So we are going to pop these. We are going to clean them both. We're going to uncap. We are going to begin by withdrawing 2.8 milliliters of air. We're going to put this in dry, and we are going to withdraw 2 milliliters of air. We are next going to inject 2.8 milliliters of air in our solution. All right, so we have 2.8 milliliters. We're going to inject that into here. Now we're going to perform that little trick again. We are going to pull out 2.8 milliliters of air. Yeah, we're going to remove 2.8 milliliters of air out of here. 2.8. We're going to inject that into our solution. Then I'm going to withdraw 2.8 milliliters. Make sure we have no bubbles. We're at 2.8. Now we're going to inject. We are going to scoop and recap. Take that off. Put that in the sharps container. We're going to put our other needle on. we are going to mix this until it is completely dissolved. Just rocking it back and forth, careful not to shake it. We are going to clean the top before we give our injection again. And it looks like we are all dissolved. So, yeah, no cloudy, no particulates. So we need to give 2 milliliters because this is mixed to 500 grams per milliliter. I'm going to pull this to 2 milliliters. I'm going to inject 2 milliliters of air. We are going to draw 2 milliliters. I'm going to pull back just a little past 2 milliliters. I'm going to make sure we have no air bubbles. And go back to 2 milliliters. All right, so I'm going to double check the medical order, and yeah, it still says 1 gram. I'm going to double check the way I mix this. It is 500 grams per milliliter. I got 2 milliliters. So now we're going to go over to my patient. Hi, we got a little shot for you here today. It's going to go kind of in your butt. Can you tell me your first and last name?
Skippy.
Okay, and your birth date?
112.
Okay, do you have any allergies?
Syllabex.
You got that one down. Okay, so I'll have you stand up. We're going to go on the ventral gluteal. So to measure that, we're going to perform hand hygiene. We're going to put our gloves on. If I had a patient of age, I might actually pull the pants down, but we're just going to pretend a little bit that I pulled that down and exposed the skin. So you're going to put your hand, my left palm, on his right thigh. We're going to put right over the greater trochanter of the hip. We're going to put my index finger on the anterior iliac crest. And we're going to give the shot right about here, right between those two. So we're going to get my alcohol pad. We're going to realign. I'm going to find that spot right there. And we are doing a ztrack. So to do a ztrack, you're going to use the base part of your hand, pull the skin back away where you inject. So it would look something like this. If you had your hand, you pull the skin back. Pull the skin back, and while you're pulling the skin back, you would do the injection at a 90-degree angle. Now this one, we are going to try to aspirate. So we're going to pull back for 3 to 5 seconds and see if any blood comes out. And luckily my kiwi isn't bleeding, so that means we go ahead and administer. So we're going to go over the course of 5 seconds. We're going to inject this nice and slow. Then we're going to pull back and remove your hand. And what that's going to do is that's going to slide the skin back over. We are going to put this in the sharps container. We're going to cover up the needle like that. Looks like we got a little bit of bleeding. So we'll just give you a little blot, blot, blot. Put a Band-Aid on you, just like that, and you're good to go.